5 actions that give hope to those contemplating suicide. Action number 1, identify the source of your unbearable pain. Most people contemplating suicide don't want to end their life, they just want to end the pain. So what is your pain? Emotional pain? See a therapist with empathy. He or she will help you end your feeling of isolation, invisibility, and aloneness. Financial pain? See an economic advisor to discuss debt reduction, lifestyle changes, and other options. How about relational pain? See a conflict mediator to help you and your loved ones get along better. Physical pain? See your doctor for chronic pain meds or other pain reduction protocols. Psychological pain? See a psychologist to address depression, anxiety, trauma, psychosis, addiction, or personality disorders. How about social pain? This includes retirees, widows and widowers, those who lose their mobility. If this is your situation, it's time to create a new normal. It isn't easy, but ending one's life is worse. It leaves a trail of broken hearts. Action number 2 is be aware of situations that put you at risk, such as persistent depression. This is especially serious if it lasts for weeks. And then if you add alcohol abuse, things get even worse. Paralyzing psychosis. If you can't function, hold a job, or get out of bed, your best option is to see a doctor for an evaluation. Diagnosed bipolar disorder puts you at risk for self-harm, but make sure it's a bona fide diagnosis, not a self-diagnosis. There are anxiety disorders. These include OCD, GAD, PTSD. These are often treated by EMDR, CBT, DBT, or gradual exposure therapy. Shame. Don't blame yourself if you were used, neglected, or abused. Reactive attachment disorder. If you didn't bond with your primary caregiver as an infant, it'll be hard to bond with adults today. Psychologists can help you work through those issues. Addiction to substances. Alcohol and drugs. A hopeful addict says, I can beat this. An addict without hope says, I gave sobriety my best shot and failed. I'll never get free. Relapse means I must surrender to my fate. Please note, relapse is part of the journey. It's a learning experience. Then there's addiction to behaviors, whether it's sex, gambling, porn, other. A trained therapist can help you understand and break out of the addiction cycle. Narcissism. Narcissists who lose their physical attributes or who no longer feel like they're the center of attention can regain hope by seeing a therapist. Bereavement disorder. Mourners in recovery move forward. Some mourners, however, get enmeshed in grief and stay there forever. See a grief counselor for help and hope. The point of all this, there are trained professionals out there who can help, and I want you to have hope. Action number 3, create an Odysseus strategy, also known as commitment device. In simple terms, this means rid your home of guns, non-prescribed pills, poisons. It helps if these items are not available when you're in your weaker moments. Action step number 4, build into your life anti-suicide traits. Resilience. The younger you are, the harder it is to believe that your pain will ever go away. Adolescents believe that a breakup or an F grade or a mistake on the sport field will result in lifelong disaster. Well, listen to an old guy. The pain will go away, and those disasters will not result in lifelong disaster. Stress tolerance. Bad things happen. It isn't fair, but life goes on. Emotional regulation. Talking to someone helps get all that pent-up angst out of your system. Some find hope in faith, spirituality, and religion, and get a reason for living. Believe that the universe is purposeful and there's a reason for you being here. And final action step is love yourself. It's hard to harm those you love, so list your positive traits, list those who love you, and list the achievements you're most proud of. Love yourself and do yourself good and not harm, and tame that dragon of low self-worth.